Hi and good day. I'm Dr. Mandell. Today I want to discuss those people, which are many of us, and I'm sure you're one of them, who spend a lot of time in a seated position, driving, sitting over a computer, looking at your text phone, texting down, looking down over and over for these long periods of time, holding a phone up to your ear. But most of the things we do day after day, particularly in the working environment, we are looking forward, we are looking down, we are going against gravity, causing these muscles to contract, to constrict, to shorten, affecting the circulation of the muscles, making the muscles become contracted, causing pain and spasming. Muscles get shortened. What do? They attach onto the bones, they pull the bones, they affect the nerves, it causes inflammation, it causes a whole gambit of symptoms, headaches, pain in the neck, tingling, numbness in the arm or the hand, into the chest, between the shoulder blades. We have a hard time sitting up straight because the muscles are working against us because of this accumulation of time of trauma, this cumulative trauma. We're putting this micro trauma that we're putting on these muscles as a result of our poor posture. We need to correct this, and the best way to do it is to change positions frequently. I'm going to show you some great little stretches to break up this monotonous that you can be doing every 30-40 minutes when you're in that seated position to prevent these problems from taking over your life and making you feel horrible. The first exercise called the shoulder roll. And what's great about this exercise, we're going to change the positioning of the firing of the muscle, that muscle that's being contracted. Very simple. You're going to raise one shoulder up to the ear and you're going to roll it back. Raise the other one up and roll it back. And you're going to keep doing this for about 30 seconds. Up to the ear and roll it back. Up to the ear and roll it back. And as you keep doing this, you're breaking up that cycle of that accumulative posture, that poor rounded shoulders, that forward head posture that's actually causing those muscles to overwork. The second stretch, you're going to reach behind your back and interlace your fingers behind your back with your palms facing together. Okay, like this, behind your back. And what you're going to do, you're going to sit in the front of the chair and you're going to slowly raise those arms. And as you do it, you're going to sit up and look up. You're going to hold that stretch as you raise those arms and feel that chest open. Breathe normally and feel that chest open. You're going to hold that about 20 to 30 seconds and you're going to release. And that's going to open up those chest muscles. Very commonly, the chest muscles, the pectoralis minor and the pectoralis major, shortens, pronating the shoulder forward, limiting your full inspiration and affecting these muscles behind the neck and the shoulders, which are actually stretching, causing a lot of that pain and discomfort. The third exercise is a neck stretch. Very commonly done. You've seen this many times, but the correct way to do it is sit up straight. You're going to grab one side of your head and you're going to pull over. Now the key thing here is I want you to lift the chest up and I want you to relax the shoulders and just slightly pull from the neck. And you're going to hold that about 10-15 seconds. And then you're going to pull forward and down. You'll feel other muscles between the shoulder blades to the same side. 10-15 seconds. You relax, put back to center, grab the other side, pull to the side, relaxing the shoulders, sitting upright, breathing normal, nice and relaxed. And you're going to pull it down and forward to the same side, and you'll feel the muscles on the opposite side, particularly inside the shoulder blade, get a nice pull into those muscles and stretch those nicely. The last exercise is called the back twist. This will release those tight muscles in the mid and lower back area and the pelvic. This is something that you should always do, and very few of us really do this particular exercise. This is one of my favorites. If I'm going to stretch my right side, I'm going to lean to my right side. I'm going to take my left hand and put it on the outside of my thigh, on my right thigh. I'm going to take my hand back and I'm going to pull as I twist to the right. I'm going to reach as far back as I can. You can look behind you and you'll feel all that stretch throughout your whole entire back. Excellent stretch. Hold that 10-15 seconds. You're going to stretch to the other side, to the left. You're going to take your right hand, put it on the outside of your left thigh, on the outside, right near the knee. You can hold that, and you're going to reach back here, and turn to the left, and reach far back as you can as you look back to the left. And you'll feel all those muscles stretch nice and gently. Feels real, real good. You can do those stretches regularly. Now, you can do these stretches every day. You can do them several times a day. The most important thing is when you're spending a lot of time sitting at the desk, you need to change positions frequently. Remember, the head going forward, the head weighs 12 pounds. For every inch you go forward, it's additional 10 pounds. That means 1 inch forward is 22 pounds. That's 22 pounds of stress those muscles behind the neck and shoulders have to hold up. 3 inches forward is 42 pounds. That's 42 pounds of stress those muscles, ligaments, tendons have to hold up. If you're doing that accumulatively over long periods of time, those nerves are being affected, the muscles are being shortened, the posture is being distorted, and it's going to cause a lot of dysfunction. Anywhere from pain, radiating pain, headaches, difficulty breathing, and the list goes on and on and on. So most important, do these exercises and stretches. I'd like you to pass this video on and share it with your friends. Put your comments below, anything that you like to ask me, or let me know how well you're doing from these exercises. I like to hear it. But most important, make it a great day. I'm Dr. Mandell.